Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. And in this edition, as you can see, I'm at a different location like I've done for the past 5 or 6 videos. And I'm in a beach house. I am on vacation and I just thought I would take some time tonight to come and do a video for you. And this video is specifically 5 things that I hate about other nurses. This I'm going to actually link with my pet peeves because some of them may be some of the same. But in this particular situation, I have updated it a little bit to kind of tell you there's some things that I don't like that I've noticed has changed since that video. So I want you to know, again, the 5 things that I hate about other nurses. If you want to see what I'm talking about, stay tuned. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for almost 17 years. OB/GYN, well baby nursery is my specialty. I'm a nurse educator. I teach at HBCU and I'm doctorally prepared. So with that being said, we're going to jump right into the 5 things that I hate about other nurses. And this is in no particular order. It's just kind of how I wrote them down. I do have a note card here to kind of keep me on track. And so the first thing I hate that I have on here that I hate, number 1, is lazy nurses. So what I mean by lazy nurses is when a nurse comes tell you what they didn't have time to do, why you come to tell me about this, you got time to go do whatever you didn't do. So, if you say, okay, you know what, Miss Such and Such had a dressing change, but I just never got around to it. Well, baby, you got time now. Go ahead and get it done because I'll wait. One thing, I just don't like people putting things off on me and causing my shift to be derailed, or I just cannot stand when people do that. Like, go finish your job. I'm not speaking of the nurses who things happen. I have worked where I have done everything I tried to do. We had a bad shift and then things come up and like, you know what? Well, that's what the next shift is for. I have no issue with that. We have crazy shifts, bad shifts, and that's when we have to say, okay, you know what? Forget all that. Let me go ahead and, I can't get it done. That's why we have 12-hour shifts. Next shift can take care of it. But I personally do not have a habit of doing that. I always set my next nurse up for success, which means also when I walk into a patient room and we doing bedside report as an example, and I look at that IV bag and it already has like 100 left in the bag and it's going at 150 an hour. And I know by the time I finish report, let alone going to get everything organized in terms of my meds and write everything out and do all that and come back, it's going to be dry. You should already had that bag already changed over by then. And if you don't, let me tell you what I do. If it's something like Pictocin or something in like a banana bag, something that has to infuse the entire bag, I will go ahead and have the next bag already scanned and ready. Or if I can't scan it because it's not a legal thing to do, at least I have the bag already pulled and hanging up there and say, hey, you got to go scan it when, it runs out. But for me, because we could do that, I go ahead and have that LR or whatever happens to be scanned and ready. All y'all got to do is prime it, okay? It's ready to go. Or if I come back during bedside report and see my other bag is done, I will go ahead and change it myself to help you out to make sure that you don't get behind. Because when you get behind in just having to change bags or a bag done went dry, therefore your line is dry, you gotta take all that down, and that takes up a lot of your time. And it makes your day, it makes you behind the entire shift. It's hard to catch up from that. So I don't like when we have lazy nurses who feel like that they when you walk up in on the shift, on the unit, you walk up on the unit, they sitting there waiting on you to show up like, hey, I've been waiting on you, but yet you got all this stuff that's not done. No, ma'am. Go ahead and all that stuff that you say you didn't have time to do, go ahead and do it. I got time, I'll wait because you had time, so you can go do it. I don't tolerate that. Number 2, nurses who make assumptions about me. So partially, yes, about race. However, it's more so about age than anything. Because I look younger than I am, when I take my nursing students to clinical, they assume that I'm a student. And when they make the assumption, they'll say, well, where is y'all's instructor? And I'll be standing right there amongst them, mind you. Where's your instructor? She should be here. He should be here with you, da-da-da-da. And they going off. They just silly going off. And I just keep my mouth shut, right? I'm just sitting there listening to them. And so then as time go on, eventually the students, they know who I am, obviously. And they'll say, oh, Dr. Pace Newburn is right here. And then they looking quite foolish when they sit there standing, they've been just running off at the mouth. Now, where are your instructor? I can't stand where y'all instructor don't even. Yeah, I've been right here the entire time. And matter of fact, I've introduced myself to the staff as such. Just this particular nurse wasn't around when I did the introduction at the beginning of the shift. And so when they find that out, and then like, doctor, like, why, what are you doing doing this, that, and the other. Or I had an assumption when I had my master's degree, they're like, why would you want to work at a hospital when you have a master's degree? First of all, Karen, I'm working in a hospital still at this point in time because you can't effectively teach if you don't effectively do, Karen. That's why I'm still working in a hospital setting. So people would assume that I could not get a job with my master's degree and I'm still working below my level because of the fact that I worked, I was still working bedside at the time. But like I tell people, you cannot educate another student if you have not been in practice, yourself. So how do I educate someone when I'm not even doing the job myself? That's the reason why we have to stay in practice. So if I have been, think about this. Have you ever went on vacation and you come back in a week or two and you don't forgot your password? That's the same thing that happens when you don't come to work for 2 weeks, 2 months, 2 years. You lose those skills. So what can I possibly teach somebody if I haven't done it? That's the reason why I stayed in practice with my master's degree. So people make assumptions that you're just not smart enough to, why would you do something like that? Like, don't question my choices. I know what I'm doing. So I would get talked about like that. Why she got her master's degree and she's still up here working bedside? Who would do something like that? Me, because I'm teaching the next nursing student and I can't teach them unless I'm actually doing it. So that's a couple of things that people make assumptions about me that, for one, I can't be a nursing instructor because I look so young. Number two, that I don't know what I know because of the fact that I look so young. And part of it may be systemic racism, that they feel like, okay, you don't know what you don't know. And when they find out I'm doctorally prepared, it just blows their mind. Like, what? Oh, you did that? Yeah, I did that. Number 3, nurses who come in chronically late to work. We are all late from time to time, or I don't say we all, but a lot of us are late from time to time. That's not an issue for me. Like, okay, well, I'm going to be late, and they call and show him I'm going to be late. But I guarantee you, I don't care if you work day shift or night shift. I worked days for the past, say, 4 years. When I looked on the schedule and saw who was coming in, I'm like, oh my God, they gonna be late. And I would hate it. I would hate it because, like, okay, well, I don't work 12 and a half hours. I'm ready to go. I'm ready to go. And you up here then coming in leisurely late. Now, mind you, this is your thing. You don't want to Dunkin' Donuts or Starbucks or whatever, got your lattes, and then you got to come in and then you got to come and talk and get cute for. I'm like, we ain't got time for that. I need to make a pot of coffee. Okay, you make the pot of coffee after you get report. That's what you gonna do. You need to come in on time and get this report from me. I cannot stand when nurses do that. Number 4, management who forget that they are still an RN at the end of the day. What I mean by that is management who, they see you having staffing issues. They see that you are drowning on the floor. They see that you are short-staffed. They see that you have high acuity, and they still walk by and ask you how things are going. I'm like, well, don't you think you need to take off your management hat, put on your nurse hat, and come out here and help us? That's what a good manager would do. Managers that I have worked for managers who have done that, and they are the best leaders you can have. But some of these managers up here who feel like, okay, you know what? I'm a manager. I ain't got to do all that. I'm not going to come in at night shift. I'm not going to stay past 4 o'clock in the afternoon. Matter of fact, I'm leaving. Matter of fact, I'm just going to give y'all a pizza to help smooth things over. Pizza don't smooth nothing over for us, okay? I need you to come in and help here with this acuity, help with these situations that we got going on. People hemorrhaging, people dying, people up here, acting a fool, people withdrawing from drugs, and you up here talking about here's a pizza. No, ma'am. Or we'll give you back your time. So we actually don't have to clock out for lunch. They just take it out of our check every shift. We don't clock out. Well, we're just giving you your lunch back. No, I needed your help is what I needed. I cannot stand the management who forgets that she, and I say she because I work OB, is a nurse, a registered nurse at the end of the day. Put that nurse hat back on and get to work and help us out here. Number 5, last one. I cannot stand a poor S-bar. So report, basically. So a poor S-bar, and I typically get this from 3 locations that I get poor S-bars from. And this is not saying that these nurses who work in these areas in totality are bad nurses. I'm just saying the issues that we have had come from these 3 locations specifically. Again, there's good and bad in every area of nursing, so I'm not knocking one versus the other. So the first place that I have the most difficulty with in terms of bad S-bar is the ER. The ER nurses will come tell you X, Y, and Z and saying that she is fine and da 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 da. And let's keep in mind, I'm a postpartum OB/GYN nurse. So why would I have a call from a direct admit, as we call them, from the ER? Well, sometimes we have somebody who may be an ectopic pregnancy and they're coming in to have a procedure done, basically, and they're a direct admit. Or maybe they had preeclampsia, they've been home and they're coming back because of the fact that their blood pressures are up again. They could be a direct admit type of thing. So we can get direct admits from the ER, direct admits from the office or something like that. So the ER nurses have been so ugly to us. They will send these patients up or claim they're going to send them up or whatever. They bring them to the floor. So we get the S-bar, then they bring them to the floor. And the thing is, we never know they was there. They never come and bring that. There's an appropriate handoff even when the patient gets to the floor. They don't sit there and give us a chart. They don't do nothing. I may happen to be thinking, man, it's been like 30 minutes. What happened to my patient? I walked down to the room and the patient in the room, chart sitting on the bed. That is not how you do that, ER nurses. That is not how it happens. You come to the nursing station and let me know that my patient is here, do an appropriate handoff, let me know nothing has changed or whatever has changed, and then we actually go and I go take over the patient care. That's how appropriate as far as done, ER nurses. And I'm not knocking all ER nurses because all of them are not bad, but the ones that I have had, some of the ones I have had, I'm like, when I get a report from certain ones, I'm like, here we go, type of thing. And I've had to call back ER management and actually report them and say, okay, you know what? This nurse did this, that, and the other. That is not how we provide care. And that's not how we transfer care from one provider to the next. We don't do that. You don't drop somebody off and not even let them know. And then I get to the patient room, they've been in there for 30 minutes. That is not how you do that. My second worst group is the PACU nurses. So why would we use PACU? Again, I have GYN surgeries that I have that come from PACU. They'll call and say, hey, we have such and such, she's going to bed, such and such, I want to call and give a report. Okay, so I get the report or whatever on the patient. They may say, this one situation, the patient was just getting Dilaudid for pain. And I'm like, okay, Dilaudid, 2 milligrams, that's all they getting? I said, they don't have a PCA that they're supposed to get? No, the doctor been doing something new. We don't do PCAs no more. I'm like, since when? Since when do we not do PCAs for our GYN surgeries? And I don't really know. Anyway, patient gets to the floor. This patient didn't have no medication on board. She just been cut from one end to the other because she had a hysterectomy. And she only got 2 milligrams of Dilaudid, and that was it. I called the nurse back and say, hey, this ain't going to work. She needs to have medication on board, and this is something you're supposed to initiate on your time. She said, well, I don't know what to tell you. I guess you have to call the physician. That's your job to call the physician. You should have known before she left the floor, left your PACU unit, that this medication was not going to be enough to cover this patient like permanently. Like, she needed to have a plan. So some of the worst reports that I get is from PACU because they either miss something or they purposely don't do something so that we have to do it. The more time I have to take care of my patient, the worse off it is for the patient, not worse for me. It is worse for me too, but the point is it affects the patient the most. And the last group, of course, is labor and delivery nurses, because again, I'm postpartum, mother baby. So therefore, when we get a report from labor and delivery, sometimes they be telling us an assessment that somebody else did the previous shift because they didn't do the assessment. Or sometimes, I don't know, there's things I'll catch that I'm like, okay, well, did you do this? Did you do this? Oh, no, I didn't know to do all that. Well, go back and do it. They give you poor S-bars. They'll have you thinking the patient's stable, get the patient and she about to hemorrhage, as an example. So poor S-bars is something that we all, as nurses, all of us, have to get better at, and making sure that what information we provide the next nurse is accurate and current as of that moment in time, not something that happened 2-3 hours ago or with the last shift and it's been hours since then. You have not did a fundus assessment since 4 or 5 hours ago. Things can change since then. You have not got your patient up to void. Things can change since then. You pulled an IV for somebody who is a hemorrhage, a risk for hemorrhage because she already has a history of hemorrhage, or because she done had 6 kids before, you're gonna pull an IV. Okay, that don't make no sense. So again, we have people who are doing bad, not only nursing practice, but they're also bad report givers. So anyway, hopefully that gave you some insight of the 5 things I hate about other nurses. Again, that's not to be about pointing out one particular group of people. Nurses in general have bad habits. That's just kind of how it is. And honestly, from time to time, I probably have done a few of these things, but that is not a habit of mine. And that's the problem that I have. These are habits of some people where this is just who they are. This is their character as a nurse. Don't be that person. So thank you for watching this video in its entirety. Please follow me on IG. It's going to be right here. Also, I'm on TikTok now, and I answer a lot of the Q&A questions, question and answer questions from the TikTok viewers or subscribers or followers, whatever they're called, on TikTok. And they ask a lot of good questions. And honestly, that's where I get some of this content from, is from TikTok. So follow me on TikTok so you can see what we're talking about over there. It's a lot of fun on TikTok. I go live on TikTok. And I think that's it. Comment, subscribe, like, share, and definitely follow me on those other 2 platforms. Until the next time, I hope you have enjoyed your Nurses Week. Till the next time, take care. Bye-bye.